Whew. Well, sneezing can be one of the most violent yet most helpful things your body is capable of.
That's right. It has health benefits and possibly some negatives. So we're going to be discussing, is sneezing good and should you hold it in or not?
That's right. We're going to discuss the most positive and negative things of it. Let's get to it.
That's what I just said. But let's get to it again.
Yeah, let's do it. I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course.
Don't throw your sneeze at me.
So we do want to get to a myth. Many people ask when you've maybe heard it all over the place. When you sneeze, your heart literally stops momentarily. Is it true or is it false, Mike?
I don't know. We're going to talk about it in this video.
It's false. Your
Oh.
heart does not stop when you sneeze. However, there are some real health concerns that some people need to know about, and you probably do if you have these conditions. We're going to get into it in detail, and you'll learn a lot.
You know what I think is harder is trying to keep your eyes open when you sneeze. We should have a
Oh,
competition.
why, Mike? Why? Let's get to the serious part.
So first, the good things about sneezing is actually a protective mechanism that helps clear your airways up. So if you have foreign particles, pathogens, or maybe allergens in your airway, it helps clear them out quickly.
Right. And it usually feels quite good, makes you feel better. Now, the bad results of sneezing, it actually spreads saliva all over the place, fine little particles, and not just that, it can go up to 26 feet away as well as up to 100 miles per hour. And we're not just making it up. That information comes from the American Lung Association. Forgive me. Now, there is another critical aspect of sneezing that really can affect a person's breathing and your health in general. Therapists must know about this, and it'd be a good idea that you know as well. And that's something known as the
Valsalva maneuver. Now, this commonly happens when you hold in a sneeze and don't let it project out, which I commonly do in the workplace because I don't think it's nice to sneeze all over everyone. But
Well, it's the idea is how much. Some people, when they sneeze, they want to be polite, and they'll go, "Ah," and they try to make a little sneeze out of it. The Valsalva maneuver is very much accentuated at that point. So the Valsalva maneuver, when you hold that sneeze in, the pressure in your lungs around your heart and in your abdomen goes way up. That can actually slow your heart rate down as well as your blood pressure. Now, for a healthy person, this is not a problem. However, there are a few diagnoses that can really be a problem. Mike, you want to list them off?
if you have cardiovascular disease, respiratory problems, ear conditions, or eye conditions, and if you've had a hernia, that amount of pressure building up can lead to problems. If you're young and healthy, like me, it's probably not an issue. But
Well, and you can have no problem if you have these diagnoses some of the time, but there will be some people, for example, if you have symptoms such as dizziness, chest pain, or difficulty breathing after you're sneezing, you need to go to your doctor and make sure there are no other underlying problems that could cause big problems.
now, the Valsalva maneuver is also used in other areas such as exercise. If you're a young power lifter, it helps with bracing and moving more weight. However, if you're older and just general fitness, it's good to breathe throughout your workouts. Don't hold in your breath and tense up.
That's right. So, in general, particular if you're older, make sure you're breathing throughout all of your exercises. You're going to exercise better, your body will respond better, and you'll just enjoy it more. Now, there are actually some medical tests that the physician or the medical staff will ask you purposely do the Valsalva maneuver. And that can be with a heart function, autonomic nervous system health, as well as ear pressure regulation. But that's all regulated and controlled, and it's not a problem at all. It gives them good information.
So the two things to remember from this is sneeze with your mouth open, I guess. Just sneeze all over
Keep
people.
sneezing. Don't worry about it. Keep sneezing, but cover your mouth with a tissue or something, and then always breathe while you exercise, and you'll be fine.
So I guess the myth is busted. You can sneeze and your heart will be fine, but you can't keep your eyes open. That's what I learned, right?
Why do I put up with them? Why? Why, Mike?
most famous physical therapist on the internet.